All right. Kendall Martis has a Master's of Arts and a Certificate of Clinical Competence in Speech and Language Pathology and is currently the Director of Outreach at Friends Academy in Dartmouth, Massachusetts, and the former director of the Sally Borden Program, an integrated program designed for students with dyslexia within Friends Academy. In addition, Kendall is an adjunct professor in special education department at Rhode Island College and is a certified speech and language pathologist and structured literacy dyslexia interventionist. She has worked in various settings, including public schools, independent schools, and private practice. Kendall is a passionate about the early identification of learning differences and fostering collaboration among special education professionals. And I am so glad to have you here tonight, Kendall. Thank you.
Thank you so much, Weddy, for that introduction. I will go ahead and share my screen here. All right. Okay. So, as Weddy said in the introduction, we're here for supporting students with developmental language disorder. I'm Kendall Martis. And let's get going. So you just heard a little bit about me. I do work at Friends Academy in Dartmouth. We are home to the Sally Borden program, which is something very near and dear to my heart. There are not many programs like ours. We have an integrated program for students with dyslexia. It begins in grades 3 and runs through grade 8. So we have a cohort of students at each one of those grade levels that have been identified with dyslexia. I also teach at Rhode Island College in the special education department. And, you know, the hat that I always wear is I'm a speech language pathologist by training. I went on to become certified in Orton Gillingham, which gives me that title of structured literacy dyslexia interventionist. I am quite passionate about a lot of things, but particularly early identification. And we'll speak a little bit about that tonight, and also kind of breaking down some silos among special education professionals, which we'll also speak about tonight. Before we begin, I want to express my deep gratitude and appreciation for researchers like Tiffany Hogan and Dr. Carla McGregor. Their research is highlighted throughout my presentation tonight. I thank these scientists for contributing evidence that can inform our work as educators. And educators, especially the ones I work with at Friends Academy, thank you for being on the front lines with the students and for the amazing work that you do day in and day out. You are so appreciated. And lastly, to my students, who are the greatest teachers of all, I think we can all agree that our students are the reason why we show up and do the work that we do. They deserve our best, and that's why I'm so glad you're here tonight. So with that said, I'd like to share this quote, which feels even more pertinent for the times we find ourselves in now. It says, "Each one of us can make a difference, and together we can make change." So I hope this presentation inspires you to make an individual impact with your students, and also to help you work with your colleagues to build systems in your schools and districts that can bring about positive change. So here are topics for tonight's webinar. We'll start by reviewing some background information to help frame us for the rest of the evening. Then we'll discuss some signs and symptoms of DLD, how it intersects with dyslexia, and lastly, how we can help students with DLD. There will be time for questions at the end of the presentation. Our first piece of background information is the understanding that oral language competence serves as an essential component in a child's life and how it develops over time. So this is a model known as the Language House that was created by Dr. Pamela Snow. It shows that building up children's oral language skills and later their reading, writing, and spelling skills is similar to the construction of a house, in the sense that both require strong foundations and careful attention to how well the house is built. So when we build a house, of course, we don't go right to building the walls or a roof. We have to think about the ground that we're building on and the solid foundation. So in this model, those parts are the social emotional context in which we use language and the early oral language experience that takes place in our early years, including the quantity and the quality of the interactions we have with caregivers in those early years. After that, we start to construct the walls of our house, and the walls are something that are continue to be built over time through the school age years and into adolescence. On one side, we have the transition to reading, spelling, and writing, and on the other side, we have the development of social skills. Again, these continue to build over many years. Our house is being built. Lastly, we build our roof. And for our language skills, that means we can now use our language to achieve academically, obtain employment, pursue further education, and lead productive lives as adults. So, language truly is everywhere. And if our skills are intact, we can be successful. So, at each point in this construction of the house, we really just have to ensure proper support and instruction to get kids to that roof level. So, what do I mean when I say oral language? Here are the components of language, which will help us better understand the symptoms of DLD. So, this is something straight out of a speech pathology textbook here, but we have three main areas of language: form, content, and use. When we talk about the components that form spoken language, we think about the sounds, which of course is phonology, morphemes or word parts, which is morphology, and then sentences form our language too, and that is the term for that is syntax. The content of our language is semantics or word meanings, vocabulary. Lastly, the use of language refers to pragmatics or how we use language in social contexts. DLD can affect students in some or all of these areas. So let's get into specifically what DLD is now. In this section, I'll talk about its symptoms, its causes, its prevalence, and how it can be identified. I'd like to start by highlighting what DLD looks like from the perspective of a person with DLD. This quote is from Paula Orego, who is studying to be an SLP in the Boston area, actually. And she was inspired to do that given her journey. So I think it's important to amplify the lived experiences of people who are experiencing DLD. And this is a particularly interesting perspective because she talks about her early development. And so it will help us understand how DLD manifests at an early age. I've highlighted portions of it to kind of show some key indicators. So Paula says, my mother was the first one to notice my language development, which seemed static at around 2 years of age. That is a definite big red flag for speech and language development. Progressing normally and then stopping or stalling is very unexpected and not typical. So that's a red flag right there. She then says, as the other children my age began to speak in 3-word phrases, eventually growing into simple sentences, I still struggled with putting 2 words together, such as blue balloon. I pointed at the objects. I wanted to alert my parents when I should have been able to form basic questions and commands. So, again, around 2 years of age, there's a huge language explosion in children. They do start forming simple sentences and phrases. And she wasn't able to do that. She was struggling with putting 2 words together. Again, a risk factor there. And she was pointing. So it shows language comprehension. She has an understanding of what things are, but is not able to express it. So again, a red flag there. That is unexpected and atypical for that age. At the same time, however, I learned both the Spanish and English alphabets as well as numbers up to 10 when I was about a year old. So this is showing the potential to learn information. However, her language is not commensurate with that learning ability. And then she says, my motor development progressed in a typical fashion. So again, motor development, okay, it really just seems like a language issue. I was a spirited, joyful toddler. So this is pulled from an article, and Paula talks about her journey in this article. And She was identified at 5 years old when she entered kindergarten, which is a fortunate thing for her. But she could have been identified even early on when you look at some of these red flags that were, going on when she was a toddler. So some of the barriers that she talks about in the article is that, because she was learning a second language, people thought it was part of that second language acquisition, which is false. That she was showing some in her native language, she was showing red flags. So that's a so that is a cause for concern there. And then some family members, she talks about saying, thought she might grow out of her communication difficulties. And that is a myth. Um, DLD is not something you can grow out of, it's something that is present at birth and manifests over time. So you don't grow out of DLD. Similar to dyslexia, it's a lifelong condition, and it really depends. Early identification is key because that shapes the outcomes later on. All right, so what are specific symptoms of DLD? So it can be present at the sound, word, sentence, or discourse level of language. At the sound level, children present with difficulties interpreting the phonological structure of language, and this is similar to a main feature of dyslexia. So, and we'll talk about the overlap in a little while. At the word level, students have difficulty understanding and using vocabulary. They may present with a lot of word finding difficulties, using general words like thing or stuff. Sentence level, a huge indicator is grammatical errors in their speech. They're having difficulty following directions, especially those with multiple steps. Um, and difficulty interpreting complex sentences. A lot of that goes to a weakness with verbal working memory. It's hard for them to hold on to so many directions or so many different parts of a sentence. And then at the discourse level, they have difficulty recalling and retelling narratives or stories. And they also have some social difficulties at times, and this is related to their difficulty with language. They may have difficulty participating in conversations, understanding jokes, and interpreting non-literal language. Again, this is related to their difficulty processing language and then also producing language. So really, to boil it all down, DLD looks like a child that may leave endings off of their words. Again, they're difficult with morphology. Their output may be just consist of simple sentences. They present their ideas in a disorganized manner. They need extended time to process information and to formulate their thoughts. And because language permeates every subject at school, children with DLD will likely face difficulties across academic areas, not just language arts or reading or writing. Um, and this is an important point. Children with DLD may appear to be shy, unmotivated, distracted, or frustrated. So again, these external behaviors could be attributed to something else besides DLD, but really at the root cause of this is language. So it's really hard to identify DLD because it can look like other things. It can look like ADHD, anxiety, or behavior issues, but again, the root issue is a language disorder. So this is a visual that was created by Dorothy Bishop and colleagues in 2017 when they sought to differentiate DLD from other communication disorders. And as you can see, DLD impacts multiple areas of language. Um, Phonology is impacted in both. So I hope you can see my cursor there, but DLD is in this big white circle here. It says areas of impairment. And then in the middle here, it crosses over with speech sound disorder. And the one area that they overlap is phonology, again, the sound structure of language. That is the only thing that they really have in common. So DLD is not the same as a speech sound disorder. So things like an articulation issue is not the same as DLD. These disorders listed over here, dysarthria, childhood apraxia of speech, articulation, that's all related to the motor production of sounds in words and actually physically producing the sounds, whereas DLD is a much more broader language issue. Again, it's with language, not necessarily speech. I also want to point out that DLD is not the same as a language disorder that might be associated with a biomedical condition such as Down syndrome. And then it's not listed on here, but DLD and autism are also two different conditions, although pragmatics, which is impacted in DLD and also impacted in autism, so they do share that feature. One difference is that in children on the autism spectrum, they sometimes demonstrate repetitive behaviors and interests and hyper-focused on things, whereas children with DLD, we find they are not that way typically. So children with DLD, they do typically demonstrate pro-social behavior with good perspective-taking ability. They just struggle with the language demands of social interaction. So again, that conversational turn-taking and participating in a fast-paced conversation. DLD is extremely common. Here are some statistics. So DLD affects about 2 children out of every classroom. So it's nearly 7 times more common than autism, and it's 46 times more common than permanent childhood hearing impairment. Let's discuss some causes of DLD. There's not one single cause, of course, and it's certainly not caused by a lack of reading or conversations at home. DLD, like all neurodevelopmental conditions, is present at birth, and it involves differences in the brain circuitry and the brain development. So these differences are very subtle and are unlikely to show up on a routine brain scan. Scientists are working to find out more about the brain and how it develops in children with DLD. So though scientists haven't determined which genes, we suspect that mutations on multiple genes put a person at high risk for DLD. And because genes are involved, we suspect, like dyslexia, there is a hereditary component to it. So people at genetic risk might have a greater or lesser likelihood of having DLD in certain environments. So, for instance, 2 children with identically the same genetic risk for DLD, if one is born full term and then the other one is born prematurely, the premature baby would have the higher risk for DLD given that environmental risk factor of prematurity. So overall, the main takeaways here are that DLD is a brain based difference, and it's influenced by both genetics and environmental risk factors. I've gotten questions in the past about multilingualism and DLD, and we discussed that a bit when we heard about Paula's case earlier. So it's essential to know that DLD is not the result of learning another language. A person with DLD would exhibit language difficulties in all of the languages they're learning, including their native language. One consistent marker of DLD across languages is difficulty with grammar. So when a child is acquiring a second language, it may seem like they have stronger skills in one language over the other. This is not DLD, that's a part of typical language acquisition, second language acquisition, I should say. To evaluate for DLD, we have to evaluate students' language skills in all of their languages that they're learning, including their native language, because then we would be able to determine if it's present there. For a moment, I just wanted to chat about an evaluation tool that I use when I'm looking at DLD. I want to be clear that it's not best practice to use a single test to diagnose DLD or any disorder for that matter, but the TILS, which is right here, the test of integrated language and literacy skills, is one that I frequently use in my battery. It has very strong statistical validity, and it does a really nice job of identifying strengths and weaknesses across both oral and written language. And it breaks down skills at the sound, word, sentence, and discourse levels. So it's really easy to kind of see that range of strengths and weaknesses in a child. And then, as we'll talk about in a little bit, it's really easy to see where a child is falling in a quadrant model, whether they have something like DLD, dyslexia, or both. I do want to mention that I do not profit off of mentioning the TILs or any of the products here. It's just a tool that I really, really like using. Unfortunately, if students with DLD are not properly identified and treated, outcomes are quite dire. Um, so thinking about that language house that we talked about at the beginning of the presentation, we can understand that these negative outcomes are a result of inadequate language foundations. So here are some outcomes identified by Dr. Carla McGregor in a 2020 paper. She found that students with DLD are 6 times more likely to have reading disabilities, 6 times more likely to have significant spelling problems, 4 times more likely to struggle with math, and 12 times more likely to face all three of these difficulties combined. So again, the language disorder is permeating every aspect of their schooling. um, People who have DLD are 6 times more likely than others to experience clinical levels of anxiety and times more likely to have clinical depression. So the social emotional health is a huge concern. Girls with DLD are 3 times more likely to experience sexual abuse. Boys with DLD are 4 times more likely to engage in what this paper refers to as delinquent behavior. And then, of course, as a long-term effect, adults with DLD are twice more likely to go over a year without employment as other adults. So despite these really alarming outcomes, students with DLD are vastly underidentified and underserved. And I just want to talk a little bit about why that might be. So first, DLD has been called many things over the years. You will get a handout at the end of this presentation that lists, I think, about 30 terms that have been used to describe DLD. And even within the field of speech language pathology, we've referred to it as different things, including specific language impairment. If a student is qualified on an IEP, it might be a communication disability. So really what we've settled on, at least in terms of speech language pathology, is the term DLD, developmental language disorder. That is the term that we are using. So you can guess without a correct label, it's really hard to create a roadmap to treat that child if we're not using a consistent label. So that was it. That's been a huge problem. Um, Secondly, our assessments and evaluation process have not been doing a great job identifying these students, and I will expand more on that in a moment. Our schools are relying on tests that have questionable validity in identifying these students, and if they're identifying it, it may not be early enough. So we have to find a better way to really capture the subtle language differences that students have. And one way I think to do that is through um, more parent and teacher reports and listening to those and classifying students that way, because that's going to make a huge difference in capturing some of the subtle language differences that students have. There's also inequities in the diagnosis of DLD related to gender, behavioral profile, geographic location, minority status, and SES. And as you can imagine, some groups are over-identified and then others are underrepresented. And then, as already mentioned, DLD has several comorbidities, so several disorders that overlap with it. And so that makes it hard to differentiate. So kids with DLD look unfocused, or they may act out because they're frustrated, and this can lead practitioners to misdiagnosing them. Spoken language deficits are definitely not as obvious as other difficulties, so it can be hard to pinpoint. I'd like to talk a little bit about what I was mentioning earlier about the silos in special education and how this results in uneven identification of these students. Um, so I would love for schools and districts to start to take a look at how we might improve our continuity of care, to take a term from healthcare, for special education students. So in the case of DLD, and sadly, this is the most ideal situation, um, a family first might receive services when they seek early intervention for their child's speech delay. So they're told, before age 3, their child isn't meeting those milestones. The pediatrician refers them to early intervention, and their child is diagnosed with a speech delay. Then, before they enter school in kindergarten, they graduate from these services and the child enters school. the parents think they're okay. Once they're in school, the child is referred for special education again, for speech language services because they're having difficulty maybe with expressive or receptive language. And then they work with a school-based SLP, and perhaps have a speech-only IEP. Eventually, they meet the exit criteria for exiting services, and because functionally their language looks good, they're participating in conversations, they're getting along with their friends, and everything's fine. Then later, as a third or a fourth grader, when students are expected to make the shift from learning to read to reading to learn, the student is referred again, because now they're not understanding what they're reading. And so now the parents are told your child has an SLD, a specific learning disability. So really, in this child's short life, they've been given three different diagnoses. They've interacted with three different kinds of special education professionals. I really think we need to figure out ways to kind of break down these silos and call it DLD from the beginning and make sure that all the educators working with this child understand what DLD is and what it looks like and how it will manifest over time. So that is just one, again, that's an ideal example. Not all students are even identified at that young of an age. So now that we better understand DLD, let's explore how DLD and dyslexia relate to each other. So it starts by understanding how spoken language impacts reading acquisition. This is the simple view of reading. Some of us might be familiar with this. The simple view of reading, which has been around since 1986, is a formula that demonstrates the widely accepted view that reading has two basic components: word recognition or decoding, and language comprehension. So a student must be strong in both decoding and word recognition and language comprehension to be a skilled reader. If either one of those components is low, then the student's reading comprehension will be at least that low as well. So this formula has been supported and validated by a number of research studies over the years. It does hold up, and it makes clear that strong reading comprehension cannot occur unless both decoding skills and language comprehension abilities are strong. So based on the simple view of reading, a quadrant model was formed by Dr. Suzanne Adloff and Dr. Tiffany Hogan from MGH, and this explains reader subtypes. So on either side, you'll see language comprehension going across, that's the purple line, and then decoding word recognition going vertically, that's the pinkish line. So and it's going from poor to good on either one of those lines. So for a student that has good word recognition and good language comprehension, they're typically developing. For a student that has poor word recognition and good language comprehension, that's very much a typical dyslexic profile. That's known as dyslexia. A student that has good word recognition and poor language comprehension, so they can read, but they don't understand what they're reading, that's DLD. And then students that have both poor word recognition and poor language comprehension have a combined type. They have dyslexia and DLD. And so based on that, we can see that dyslexia and DLD are distinct, but they're often co-occurring disorders. So research suggests that it's likely that half of the children who have dyslexia have DLD, and half the students that have DLD have dyslexia. So there is a strong overlap here. And I do want to note that children with dyslexia but without DLD may have language deficits too, outside of the phonological system, particularly with word learning. And I'll talk a little bit about that. One of the reasons that is something called the Matthew effect. And this is coined after a Bible verse where the rich get richer and the poor get poorer. So children with dyslexia who don't have as much reading experience, they decrease their exposure to rich language because of that lack of reading experience. So thereby they're not increasing their vocabulary acquisition. So knowing more about these students with DLD and that students with dyslexia can have vulnerabilities in oral language, what can we do to help these students? So the rest of this presentation, I'll discuss ways to support learners with DLD by enhancing screening measures, increasing awareness of DLD, and implementing effective instructional strategies. So it begins with effective screenings. And I think this is my second healthcare metaphor of the night, but let's think about screenings in the context of healthcare. So healthcare screenings are very common. They're a way to identify risk, a health risk. So for instance, I may go to my primary care provider and have my blood pressure taken. That's a screening tool for hypertension. The benefit of that screening is that if I have a positive test result, if I have high blood pressure, I can be provided with early treatment. My PCP might recommend lifestyle changes. They may, consider medication. They may consider additional evaluations. So universal screenings in schools can serve the same purpose. They identify children at risk for language and literacy difficulties so that interventions can be put into place and further evaluations can be conducted. It also helps you monitor your progress over time and how you're responding to the interventions in place. And while universal reading screenings have improved, and I know the state of Massachusetts has passed laws, mandating universal screenings, um, but those don't include oral language to the extent that they should. So knowing that DLD and oral language deficits can exist so much alongside of dyslexia, we really do need to be screening for oral language skills as well, not only for the purpose of early identification, but also for identifying the right kinds of interventions. So once students begin to decode, you have to make sure you're assessing the other side of that simple view of reading to ensure that they can make meaning from what they read. So if language comprehension is not intact and they fail a reading screening, more decoding instruction's not going to work. What they need is building language skills that support the reading comprehension. They may need work in vocabulary, grammar, and inferencing. So the link on this slide, and you will have it in a handout at the end of this presentation, is a link to Dr. Tiffany Hogan and her colleagues. They have curated a list of oral language screening tools. It is free. Um, so check that out on your resources. I've included screenshots of a few tools that I've used. The first one is the student language scale. This comes from the TILS. It's included. It's a parent or educator questionnaire, again, trying to capture the input of families and teachers to screen students. The second one is Cubed, which is a free download. I believe the company is Language Dynamics. That's on Dr. Hogan's list. And it consists of narrative retell as a way to assess oral language. And then the third one is not on this list, but one that I wanted to include. It's Early Bird, which I believe has just been bought by Imagine Learning. My school, Friends Academy, was an early adopter of the Early Bird platform, and it is for students pre-K through second grade only. But what I really like about it and what drew us to it initially was the inclusion of oral language subtests, which are so crucial for all students learning how to read, but especially young learners. So it includes oral language subtests as part of their screening. So just be aware that many children with DLD are flying under the radar. Our traditional screening methods are missing a lot of kids with DLD. Some research suggests that we may be missing up to 80% of kids with DLD. So we need to think of ways that we can increase that identification. In addition to screening for oral language, we can suggest that SLPs and teachers routinely consult with each other about students who may be presenting with language problems. SLPs could also spend time in classrooms observing students to see if they can identify students with red flags. And while this is a more difficult undertaking, is there a system in your district or school that routinely monitors students who present with a risk for DLD? And if not, is there a way to consider building that type of system? Again, that speaks to kind of breaking down some of the silos that spoke about earlier. In 2023, so just last year, in response to lobbying from speech pathologists such as Dr. Tiffany Hogan and Dr. Carla McGregor, the US Department of Education released a memo similar to the one that was released about dyslexia, saying that DLD is covered under IDEA. And so we can use this information to spread awareness of and access services for children with DLD. Basically, the memo gave us permission to use DLD in special ed contexts, including in assessments and evaluation reports and at meetings with families. While it's not its own separate disability category, we can use the word DLD to describe a child's vulnerabilities under maybe a different category like communication impairment. So again, the child may be qualified under a communication impairment, but in the summary and the test results, we can use the word developmental language disorder to capture that child's vulnerabilities. So moving on to teaching students with DLD, here's an excellent reference guide that I've also included on the handout with 6 easy tips to consider when teaching students with DLD. The first one is more, and that is that we should provide more examples, more repetition, and more ways of explaining new concepts for students. Number 2, more is not more when it comes to length and complexity of what we're saying to students with DLD. So we really need to keep our sentences short and sweet. When explaining new ideas, we have to try to use words that students already understand. Number 3 is adapt assignments. We may need to reduce the language load on assignments for students with DLD. So to do so, you might offer a word bank or a multiple choice question instead of an open-ended question. Number 3 is offer visual supports, which are crucial for scaffolding students' understanding and providing a visual anchor during oral instruction. Number 4, pace of instruction. So modify the pace as needed, and when something seems tricky to your students, move on and come back to it later. Lastly, specialized instruction will be very important for learners with DLD. They may benefit from small group instruction, frequent check-ins for understanding, and collaboration from other educators working with the child like an SLP. So I'll get into some other ideas for specialized instruction now. Recasting is a very effective evidence-based way of responding to children when they make an error in grammar or speech production, which many students with DLD do. It can also be used to model expansion of sentences. So to recast, you simply repeat the child's utterance in a more complete phonologically, grammatically, and/or semantically appropriate word, phrase, or sentence. And there's no need for the child to imitate it back to you. So I have an example here, one pulled from my own life with my 7-year-old who I frequently use this tool with. She's might say, "I drawed this picture for you, mommy," which of course drawed is in incorrect grammar. So you would just simply say back, not pinpointing her mistake, but saying, "You drew a beautiful picture for me." And just that simple modeling of correct language has been shown to improve language for students who are with DLD. So next is the Strive for 5 framework, and this comes from research by Dr. Sonia Cabell, who wrote the book pictured here, Strive for 5. So she found that her research in her lab found that 5 conversational turns is really ideal. It's long enough to elicit a meaningful response from students, but short enough to match most young children's developing attention and language skills. Even though most of her work has been focused on young learners, I think this is a nice framework for all educators in thinking about being more intentional and encouraging conversations with their students. So the Strive for 5 framework starts with an open-ended question from the teacher. It is important to know that if our aim is to have a dialogue, it's key that we're using open-ended questions and not just one that elicits a yes or no response. So the teacher asks an open-ended question and then the student responds. After that, the teacher asks a second question to elicit more language from the student. And the second question may extend the student's thinking if they were correct the first time, or it might provide a scaffold like recasting to model formal syntax. Um, the student then responds to that second question, and the teacher provides a statement that expands the child's response again. Um, so I encourage you to check out Dr. Cobell's book here if you teach young children. It's very practical, easy to read, and has many great tips. But again, I think the takeaway message here for all educators is that to increase oral language, we have to start engaging in conversations with students and intentional conversations and intentional ways of doing it, like this framework. So the strategies that I've just been talking about, as well as some of the tools that I'll talk about next, not only benefit students with DLD, but all students. And I show this cartoon in my presentations quite frequently because it exemplifies this concept very nicely. So this is a comic where it is a snowy day and there is a person shoveling snow off of a building's staircase, and um, the person in the wheelchair says, "Could you please shovel the ramp?" And the person shoveling says, "Well, all these other kids are waiting to use the stairs. When I get through shoveling them off, I will clear the ramp for you." And the person in the wheelchair says, "But if you shovel the ramp, we can all get in." So again, these strategies open up doors for students with DLD, but of course they allow all students to succeed. For children with DLD, it's really important to make associations to previously learned information. Making associations is so helpful to students when they're learning the meaning of new words. Semantic feature analysis is a research-based instructional activity that can be used to make associations. So research shows that word learning takes place most efficiently when the reader or listener already knows something about the context related to a new word. So we learn words up to 4 times faster in a familiar context than in an unfamiliar one. So vocabulary instruction that compares and contrasts word meanings and activates prior knowledge not only helps the student learn new words, but it's been shown to improve comprehension of the text that they encounter those words in. So this is a sample semantic feature analysis grid from a blog post that Joan Sedita wrote at Keys to Literacy. This semantic feature analysis, I like this example because it contains math words. Math is its own language, of course. So so the math words are down listed on the left-hand side, and the features of these words are listed across. And the students would put a plus or a minus to indicate if the corresponding word did or did not have that feature. Again, this helps students to think about the contrast, the comparison, and the contrast between words. And it's a really helpful way for them to organize their knowledge of what they know. And then when it's more organized, they're more likely to retrieve it or to recall it. Related to retrieving information, metalinguistic skills, which is thinking about language, are super important for students to develop so that they can think about what they already know. To do this, you can support students to use self-questioning strategies. So when they're encountering a new word, they can ask themselves, what kind of word might this be? Can I hold it or touch it? Can I do it? Would I use this word to describe? So you're getting them to think about its meaning, how it might be used in a sentence. And similar to this, building metalinguistic ability, you can model how to derive meanings of unfamiliar words using morphology, and you can do so by think alouds and then gradually releasing responsibility to the students. So for example, in the sentence, his appendix ruptured, a student might be unfamiliar with the word ruptured. So again, you're modeling this to students and then expecting them over time to take more responsibility of this. But if I'm modeling this, I'm saying, this is a long word. Let me see if I can find a part I know. Oh, I know rupt. We've talked about that before. Rupt means to break, like a volcano erupts. I also see ED, so that tells me that this has already happened. And I know appendix is a body part, so maybe his appendix exploded. So again, you're getting them to think about and figure out what the meaning of this word is based on its parts, based on its morphemes. For syntax, we can also, we need to really provide scaffolding and break down sentences with difficult structures. And I have 4 structures listed here that I will give examples of next. This comes from an article cited here, but these 4 types of sentences have been found to really be difficult for students with language disorders. And so breaking them down for students, providing them additional ways to comprehend them is really effective. So the first example is sentences written in passive voice. And so this is an example. The hiker was chased by the bear. This can be tricky because students would think, you know, based on the order of the words, that the hiker might be doing the chasing. But in this case, it's the bear that's doing the chasing. So to support students with this, you might ask them directed questions and really provide some scaffolding to get them to think about the meaning here. Adverbial clauses is another tricky concept for kids, and in the 2 sentences here, why they're even more confusing is because again they're presented in the opposite order in which they're happening. So the first word is, or the first sentence is, after the storm hit, the Red Cross arrived. So it's a little confusing because that word after is in the first adverbial clause, and it's confusing for students to keep track of. The second one is clap your hands before you touch your nose. Again, before you touch your nose is presented second, but it's really the first direction that you're doing. So providing I've highlighted them here. I've done that for students before where you're really providing some visual ways for them to see what these sentences mean. And just noting that these exist in a lot of the texts that they read and being aware that these may pose a problem for your students. Another type of sentence is are sentences with embedded relative clauses. So this is a clause that describes the subject. So the boy who lost the dog walked home. Students might be confused. Is there somebody else that lost a dog? And you have to really tell them the boy is the one who lost the dog, and now he's walking home. So really kind of making that clear to them. Again, the students with DLD often have verbal working memory challenges, and so their cognitive load is easily taxed, and it's hard for them to hold on to so many different pieces of information at a time. So in a sentence with 3 or more clauses, it's going to be very tricky for them to hold on to all of that to make meaning from it. So just again, providing some sort of visual support, like in the sentence here, we lost the game because our running back fumbled the ball after he was hit. So I broke it down by kind of 3 different actions for them to understand the meaning of the sentence. And at the discourse level, we can support discourse level skills by using nonfiction text to build background knowledge, and in doing so, explicitly teach text structures. We can also incorporate listening comprehension activities into our instruction by doing read alouds. And when doing so, you want to model your thinking and provide opportunities for comprehension monitoring. We also want to allow opportunities for students to orally summarize as they're reading. And I have this acronym here. This is CROWD, an acronym that you could use during a listening comprehension activity like a read aloud. So CROWD is just an acronym to help us remember the types of questions to ask about a book when you're reading. So C stands for completion. So in that type of question, you're asking the child to complete a sentence or phrase from a book you're reading. For example, you're reading about butterflies, and you might say to the student, the stages of the life cycle of a butterfly are egg, caterpillar, chrysalis, and they're filling in the blank. So that's completion. R is recall. So you're asking details about your reading, of what you're reading. So you might say, can you describe how the caterpillar builds a chrysalis? O is open-ended, so you're asking an open-ended question, perhaps about a picture in the book. You might say, what's going on in this picture? And asking the child to respond to that. W stands for asking WH questions like who, what, where, when, or why. So as an example, what does a caterpillar do after it hatches from the egg? And then stands for distancing. So this means asking questions that relate to something in the story in the child's life. So you might say, remember when we saw that butterfly on our walk yesterday? What type of butterfly was that we saw? So again, you're getting the child to relate it to their own life. A multidisciplinary research team known as the Language and Reading Research Consortium developed a free, well, in other words, a taxpayer-funded curriculum called Let's Know. And the purpose of Let's Know, again, it's all free. It can be accessed on this URL here. The purpose of this curriculum is to develop skills that are foundational to reading comprehension. So a lot of listening comprehension skills, building vocabulary, understanding of grammar, and inferencing. It's a systematic scripted curriculum that includes 3 7-week units and 1 4-week unit, which span 1 academic year for students in grades pre-K to 3. So Let's Know uses core content such as science texts and storybooks to develop language comprehension skills. Again, students are exposed to different text structures. They're asked to make inferences, build vocabulary, and monitor their comprehension. Lastly, students with DLD may need support with pragmatics due to difficulties with language production and processing. And so I've listed several skills here that contribute to effective participation in social interactions. Students with DLDs may need scaffolding to support the development of these skills, such as role plays, extended wait time during conversations, and direct explanation of abstract language. So just 4 takeaways for tonight. We've reached the end. DLD is a neurobiological difference where the understanding and use of language is highly impacted. Number 2, DLD and dyslexia have a strong comorbidity. There's not yet a strong awareness of DLD in educational settings. We've talked a bit about that tonight. I'm hopeful that we all can change this together. And lastly, consider making changes in your screening practices and implementing some of the strategies discussed tonight into your own work with students to support those with DLD and all students. I just wanted a moment to plug my school. So again, I mentioned we have the Sally Borden program, which is our school-based program, but we also have an external program known as Sally Borden Connect, where we offer tutoring, we offer Orton Gillingham teacher trainings, we provide evaluations and consulting, and we also have a summer program for students as well. So check out that QR code for more info. And a new initiative that we have going on is we've just kicked off free literacy screenings at Friends Academy in Dartmouth. And these are held once a month on Saturdays. And check out that URL for if you're interested in signing up a child for that. And I really appreciate your time tonight. I'll take a few questions, I think, now, and then, but if we don't have time for everything, please feel free to contact me at the email provided. So thank you. Thank you again.
That is perfect. Oh, thank you so much, Kendall. So there is one question that was in the chat, and it was from a user about midway through your presentation. Wanted to know, would a child likely have DLD if they're using the word thing a lot when they're between the ages of 2 and 5 years of age?
That can be an indicator of word retrieval difficulties, which could signal some difficulty with expressive language. So if there are other signs, particularly inappropriate grammar, or leaving off of word endings, that sort of thing, that might be even more of a warrant further evaluation. Just word retrieval alone, I don't know that I could diagnose that as DLD, but it definitely is a red flag, especially when it's combined with other symptoms. I see some other questions in the chat. Um, so a question about identifying and assessing DLD in bilingual and multilingual students. Um,
Ooh, great
so
one.
I think I covered that a little bit, is that it's hard, but we really have to assess them in their native language to see if there's the language disorder there as well. If there's grammatical errors and difficulties with expressive language and vocabulary in their native language, then it is DLD. Because again, DLD would exist in every language that they're learning. So the child would ideally have to be assessed in their native language to understand whether they have DLD. And then what intervention strategies and best practices are most effective for supporting language development in multilingual students with DLD, both in school and at home. I think a lot of what we're talking about today supports those kids. I don't think it's anything different. Um, Language is language, and they'll just need a lot more repetition and practice with it. But a lot of these strategies presented today will work for students who are multilingual as well. But I would, in terms of getting educators and families on board, I see that as a third part to the question. I would talk about DLD with them, and making the distinction that it would be in all languages, not just one or the other. That would, if there is a stronger usage of one language over the other, that would be more of a language difference rather than DLD. And then I have another question here about, it looks like a specific child. Um, just the recommendations about evaluators. I would really reach out, if you're concerned specifically about DLD, speech language pathologists are ones that are trained and have a lot of expertise in language. So I would reach out to a speech language pathologist to get an evaluation of your child. So I hope that helps here. Um, One person was asking about our literacy screening in Dartmouth. So you can check out the link and it will give you a lot of info there, but the link takes you to a Google form which you complete about the child, and then we determine whether they would benefit from the literacy screening. It covers all of the foundational skills. Again, it's a screening, so it's not going to diagnose. It will just identify any risk factors, but it would provide a snapshot of how the child is learning to read and to write. So we look at phonemic awareness, decoding, encoding, listening comprehension, narrative retell, and we look at all those skills to determine if they're on track or not. I think that's it. Were there any other questions that came through that I might have missed?
No, I think you answered all of them. And I just really appreciate you again for your time and again, your wonderful expertise. What a treat that participants got today from listening to you. I know there's some great resources that I'm going to go and check out as well. In addition to participants who are still here, we would love it if you could take a moment to complete our IDA Massachusetts branch feedback form. And we'd love to hear some feedback from you. And Kendall, do you have one last word or anything else? Or
Thank you so much, IDA of Massachusetts, for having me tonight, and I can't wait to continue our work together. So thank you so much, everyone, for attending tonight.
awesome. Thank you.
Thank
And
you.
that was wonderful. And here is the form again for folks who are still here. Please take a moment to complete that form. And Chris, any last words? Thank you. Thank you, everyone.
Yes, thank you everybody for joining us. And please fill out the survey because we want to meet your needs. And so we need to see what you guys are interested in.